Hi, in this presentation we will be learning how to communicate with the patients. The presentation has been prepared by Dr. Yashwant Joshi, Vice President of National Association of Palliative Care for Ayush and Integrative Medicine. So, we can see over here, it is not what you say, but how you say, and in fact even we can see this loudspeaker denoting a poor communication with the patient. So, difficulties for professional and patients. Now, we can see here there is a barrier in between the patient and the doctor. So, we have to counter the barriers. So, in case of doctor-patient communication, difficulties for professionals are there, and there may be difficulties for patient too. So, difficulties for the professionals may be upsetting the patient and handling reactions, being blamed, doing harm, do not have the knowledge and the skill, how to say I do not know, too busy, to concentrate more on physical issues, not part of my job, cannot make it better, the language and the dialect. Difficulties for the patients may be lack of time and privacy issues, other than physical, to tell or not, afraid of the truth, afraid of the treatment being denied, fear of losing control over emotions, unfamiliarity of the surroundings, the medical speech or authoritative hierarchy. Communication barriers: patients might not ask questions because they fear the answer, want to avoid feeling stupid, consider their uncertainties trivial, feel rushed, were previously brushed off by the doctor. Patients might not disclose problems because they do not want to seem negative or ungrateful, want to be strong, think their concerns are not legitimate, do not want to add to the doctor's burdens, believe nothing can be done. Doctors block communication when they give cues that they feel time pressure, allow distractions, do not acknowledge the patient's emotions, address physical aspects only, offer reassurance before the main problems have been identified. Communicating in difficult situations can make communication feel impossible or at least secondary to survival and protecting your self-interest. Both stress and uncertainty can team up to evoke your fight or flight response in personal as well as professional settings. An easy way to remember the communication skills needed for practice is summed up in a catchy acronym: RESPECT. Here are the 6 things you need to know in this acronym. R stands for rapport. This is of vital importance, noting the smallest details such as physical appearance, your level of eye contact with the patient, or how often you use their names in conversation, can shape your relationships with the patients. You need to give patient your full undivided attention, listen carefully and hear their stories. E for explain. Ask patients a variety of questions that encourage them to explain more about their health and habits outside their appointments. Questions such as, can you tell me more about yourself? What is important to you? And what can I do to help you? Can incite patients to fully engage in conversation. S for show. Regardless of your specialty or practice setting, you will have to deliver constructive criticism during your career. Work with them in an active way rather than telling them what to do. With the proper approach, a critique can become an opportunity to bond with your patient. For instance, try a 7:1 compliment ratio. Give your patient 7 compliments for every 1 statement of criticism. P for practice. Practice may always make perfect, but it certainly can help you get ahead of tough conversations with patients. Practice good communication as much as possible. Empathy. Avoid being judgmental by providing encouragement to your patients. This can be expressed through verbal and non-verbal cues. C for collaboration. Keeping in mind that people are far more likely to positively respond to recommendations and questions in collaborative settings. Partner with your patients. Explain your recommendations, what you are doing and how you are doing it. T stands for trust. Trust is the most important component of this relationship, and trust is not something that we buy or demand from others, but it is something that we gain. If we want others to trust us, we need to respect them first. Now, here we can see that the nurse is telling this patient that the doctor will see you now. I can't promise that he will talk to you, but certainly he will see you. That means the doctor does not have time and he is simply going to be with the patient for a very brief time. So, continuing therapeutic dialogue with the patients. Duke is one of the world's premier center for medical education, clinical care and biomedical research. Planning for the school began in 1925 when businessman James Buchanan Duke bequeathed $4 million to establish the Duke School of Medicine, the Duke School of Nursing and Duke Hospital. Less than 5 years after the school opened in 1930, the Association of American Medical Colleges ranked Duke in the top quarter of medical schools in the country. Now, more than 75 years later, the Duke University School of Medicine is firmly in the top 10 medical schools nationally. So, continue your statement. An educational program developed by James Tulsky, Director, Center of Palliative Care at Duke University, Durham, NC, teaches the use of a continuous statement when an opportunity for an empathetic response occurs in a patient encounter. Such a statement offers empathy and allows patient to continue expressing emotions. The Duke team uses the mnemonic nurse to label 5 types of continuous statements. And for name, state the patient's emotion. U for understand, empathize with and legitimize the emotions. R for respect, praise the patient for his strength. S for support, show support to the patient. And E for explore, ask the patient to elaborate on the emotions. Good communication skills, improving palliative care communication. Techniques to improve palliative care communication. Sit at eye level with the patient, be focused on the patient during the visit, make eye contact, speak in short sentences, use simple language and pause frequently, use drawings and pictures to explain a procedure or a condition, ask the patient to describe his or her understanding of your explanation, give a written summary of recommendations. Techniques improving palliative care communication continued. Acknowledge the patient's feelings, determine how involved the patient wants to be in decision making, Find out about the social and financial concerns of the patient and family. Fight the urge to interrupt the patient. Allow silence during the conversation. Hide any cues that you feel time pressure. Avoid asking simply, "Do you understand?" 10 commandments in communication. Thou shalt not do all the talking. Thou shalt not force your convictions on the patients. Thou shalt not make assumptions. Thou shalt not be patronizing or condescending. Thou shalt not moralize or philosophize. Thou shalt not draw comparisons. Thou shalt not sympathize. Thou shalt avoid jargon. Thou shalt avoid life as well as thoughtless honesty. Thou shalt avoid inappropriate humor. Thank you.